U.S. health officials are bracing for what's expected to be a rough respiratory virus season fueled by holiday travel and a new flu variant.
So this morning we welcome in Dr. Vanessa Walker with Sutter Health. Thank you so much for joining us this morning.
Absolutely, happy to be here.
So what are we seeing right now in hospitals?
So actually the hospitalization rate is not very high, it's kind of low. What we are seeing though over in the UK is a really big uptick in cases of influenza in younger people, actually under the age of 45. And it's hospitalizations are increasing. So we can imagine that's going to start heading our way here as the influenza season picks up.
And what do you doctors think is kind of the cause of this uptick that we're seeing now?
Well, you know, once you start getting more virus spreading amongst more people, traveling, holidays, you're going to just see it pick up. So sometimes of the year it's early December, others it's not until later on in January or February. This year I think we're going to start seeing it kick up by the end of the month and then probably really hitting us harder in January.
Is there a particular strain right now that you're really seeing?
Yes, the H3N2 subclade K. I'm getting a little nerdy there. Doesn't really matter for most of us, but really it's the influenza A virus. We're seeing it. We've seen it before. It's not new. It's just this is the predominant strain that we're seeing right now.
All right, we're talking about the holidays, Christmas coming up, New Year's. What should people be doing to protect themselves?
All the same stuff I've said. Washing your hands, making sure that you're not touching your face because that really gets it in there if you get it on your hands. And then vaccination. That is really key. That helps spread it and also decreases the severity if you do get it. Making sure that if you are sick, please don't go out. Wear a mask if you have to, but really try to stop spreading it to everybody else.
Yeah. And again, this is one of those times of year now, especially now that we're post-COVID, a lot of the symptoms can seem pretty similar.
Absolutely. The good news is we're not really seeing a lot of COVID or RSV right now. So if you are feeling achy, cough, shortness of breath, fevers, you probably have the flu.
What are the symptoms or the signs that folks know that they do need to actually go to the doctor and not just kind of self-medicate?
So the thing is actually we have a good treatment for influenza, and the key is to get it in your body within 24 hours of symptoms. So if you're somebody you're feeling, you got a fever, you're not feeling good, give your doctor a call, try to get into an urgent care, because the quicker you get the medication in, you can actually decrease the length of the illness by 3 days.
Wow, okay.
Yeah.
Okay, all right, well, doctor, we always appreciate your time and your insight. Thank you so much for joining us this morning.
No problem. Thank you.